Hi everyone, my name is Brianna, and in this video I will be walking you through the anatomy and physiology of the heart, one of the most important organs in the body. We will be focusing on the anatomy of the heart, cardiac conduction, and its cycle. So we're going to start with the anatomy of the heart. The heart is located in the thoracic cavity, which is the chest cavity that also contains the lungs and great vessel. More specifically, it sits in the mediastinum, which is the central compartment of the thorax, between the right and left lung. The heart is about the size of a closed fist and slightly offset from the left side of the body. The base of the heart is the broad superior portion where the majority of the blood vessels enter and exit, while the apex of the heart is the narrow, pointed end that tilts down into the left. Their layout allows the heart to rest on the diaphragm with its apex touching the chest wall. Externally, the heart has 4 chambers, 2 atria at the top and 2 ventricles at the bottom. The right atrium receives deoxygenated blood from the body through the superior and inferior vena cava, while the left atrium receives oxygenated blood from the lungs through the pulmonary veins. The auricles are small ear-shaped pouches on each atrium that expand to hold extra blood. Below them are thick-walled ventricles that pump blood to either the lungs or the rest of the body. From the picture, you also see several great vessels connected to the heart space, including the pulmonary arteries, pulmonary veins, and aorta. When we look at the inside of the heart, we can see 3 major septa or walls that separate the chambers. The intertrial septum separates the left and right atria. The interventricular septum divides the ventricles, and the atrioventricular septum separates the atria from the ventricles. Within the heart are 4 valves that ensure unidirectional blood flow. These are the tricuspid valve between the right atrium and ventricle, pulmonary valve leading to the pulmonary artery, and the mitral valve between the left atrium and ventricle, and the aortic valve leading into the aorta. Papillary muscles and choroidae tendae are sometimes called heartstrings, and they anchor the valves to prevent them from inverting or prolapsing when the ventricles contract. The heart wall is made up of 3 main layers surrounded by a protective membrane known as the pericardium or the sac. The outermost layer of the sac is called parental pericardium, while the inner layer, which directly covers the heart's surface, is called the epicardium. Between them is the pericardial cavity filled with pericardial fluid that reduces friction as the heart beats. Beneath that lies the myocardium, which is a thick muscular layer composed of cardiac muscle cells responsible for the heart's pumping action. The innermost layer is the endocardium, which is a smooth lining that prevents the blood from sticking to the walls or clotting as it flows through the chambers. Okay, so let's use this graphic to trace the blood flow through the heart. Deoxygenated blood from the body enters the right atrium through the superior and inferior vena cava. From there, it passes through the tricuspid valve into the right ventricle. When the right ventricle contracts, blood is pushed through the pulmonary valve into the pulmonary arteries, which carries it to the lungs. After picking up oxygen, blood returns via the pulmonary veins into the left atrium. Then it travels to the mitral valve into the left ventricle. This is really the strongest chamber. Then finally, blood exits through the aortic valve into the aorta, distributing oxygen-rich blood throughout the body. This is a continuous pathway, and it maintains circulation, ensuring every cell receives oxygen and nutrients. The heart also needs its own blood supply, and that's where the coronary circulation comes in. The coronary arteries branch off from the ascending aorta and wrap around the heart. This delivers oxygen-rich blood to the myocardium. The coronary veins then collect the deoxygenated blood and drain it into the coronary sinus, which empties right into the right atrium. Without proper coronary blood flow, the heart's muscle cells can die quickly, and this can lead to conditions mainly like angina and a heart attack. A common issue that can occur within the heart is the mitral valve prolapse. This happens when the flaps of the mitral valve bulge backwards into the left atrium during ventricular contraction. As a result of this, the blood might leak backwards, a problem known as regurgitation. Over time, this can cause the heart to work harder, leading to symptoms like fatigue, shortness of breath, and palpitations. Mitral valve prolapse is often detected through an abnormal heart sound or a murmur heard with a stethoscope. While mild cases might cause a few issues, there are also severe cases of regurgitation that can require surgical repair or valve replacement. Okay, now we're moving into section 2, and we're going to talk about the muscle tissue. The heart's ability to beat on its own is due to cardiac muscle tissue, which is made from two types of cells: contractile cardiomyocytes that shorten to produce force, and conductive cardiomyocytes, also known as pacemaker cells, that generate and transmit electrical impulses. These cells are interconnected by intercalated discs, which contain desmosomes and gap junctions. Desmosomes act like a strong anchor holding the cells together during contraction, while gap junctions form electrical bridges that allow ions to pass directly from one cell to another. Okay, so now we're going to follow the electrical signals traveling through the heart. The heart begins at the sinoatrial node, or the SA node, located in the right atrium. This node acts as the heart's natural pacemaker, spontaneously generating electrical impulses between 70 and 80 times per minute. These impulses spread across the atria, causing atrial contraction, then reach the AV node, which briefly delays the signal to allow the ventricles time to fill with blood. From there, the impulses move into the AV bundle, which splits into the right and left bundle branches within the interventricular septum. The branches and fibers then spread the signal rapidly through the ventricles, triggering contraction from the bottom up. I'm not sure why the slide presents it like that, but pacemaker cells depolarize automatically thanks to leaky sodium channels. Calcium influx through fast and slow calcium channels trigger contraction, while potassium exits to repolarize the cell. The fast pacemaker cell, the SE node, it sets the heart rate. To visualize the heart's electrical activity, we use an EKG. The P wave represents atrial depolarization, which triggers atrial contraction. The QRS complex reflects ventricular depolarization, the signal that causes the ventricles to contract, and it's usually the largest wave on the graph. And then the T wave represents ventricular repolarization or recovery. When the heart's conduction system is disrupted, we can see this on an EKG, so it'll have irregular waves or abnormally slow waves. So they're essential tools for monitoring overall health of the heart. So now we're going to move into the cardiac cycle. So one complete cardiac cycle is a heartbeat, one single heartbeat lasting 0.8 seconds at rest. Each cycle has two main phases: systole, when the heart contracts to eject blood, and diastole, when the heart relaxes to fill with blood. So the cardiac cycle can be divided in 5 phases. It starts with ventricular filling, when pressure exceeds, causing the AV valves to open and blood to flow in. The atria then contracts, then the ventricles begin to contract, and both set of valves close. The closure of the valves creates the first heart sound. The aortic and pulmonary valves open, and then pressure in the valves drop, and the semilunar valves close, producing the second heart sound. Now we can look at the EVD, which is the amount of blood in the ventricle at the end of filling, and ESV, which is what remains after contraction. The stroke volume, or the SV, is calculated by SV equals EDV minus ESV. The cardiac output, or the CO, is the amount, or the total amount, of blood pumped by each ventricle per minute. It's calculated by multiplying heart rate by the stroke volume. Okay, now that we've went through the modules, I have a little review set that you can go through and test yourself with. You can pause at the question and then have your answer, and it will be at the next slide. and good luck with the test.